The human immunodeficiency virus is an infection that attacks the human body's immune system. IV targets the white blood cells of the body and weakens the body's immunity, due to which a person's illness risk is increased by different diseases like tuberculosis or even cancer. HIV has 3 stages, and the ultimate severe stage is known as acquired immunodeficiency syndrome, in short AIDS. This disease is also known as a sexually transmitted disease and is spread by contact with infected person's blood, breast milk, or vaginal fluid. The 2022 report by the World Health Organization revealed that about 39 million people are living with HIV. It also indicated that 630,000 people had died of HIV and 1.3 million due to AIDS. Here, the question is raised: how did it come to be, and how far back is it dated? The first recognized case of HIV by WHO was in the 1980s, originating in Africa. Later on, this disease became a global pandemic as it affected millions of people globally. Its history dates back to the late 19th and early 20th century. Chimpanzees and other non-human primates are the primary cause of this illness. It plays a significant role as it is thought that a strain of simian immunodeficiency virus that exists in chimpanzees crossed humans and led to human immunodeficiency syndrome. How can one find out if they have HIV? Tests are the only way to determine whether someone has HIV or not, because some people have no symptoms at all, while others may have fever, headaches, swollen lymph nodes, muscle pain, and night sweats, among other common symptoms of any disease. IV is incurable, but it can be controlled and treated with medication at an early stage. Let's start our video by finding out the leading causes, transmission, treatment, and medication for this fatal disease. What is HIV? HIV is a human immunodeficiency virus that attacks cells of the body's immune system, and as a result, infected person becomes more vulnerable to other infections. As HIV enters the body, it affects the white blood cells known as T cells or CD4 cells. CD4 cells are destroyed by this virus, resulting in a gradual decline in white blood cell numbers that makes the immune system unable to fight against any infection. HIV is a retrovirus. Its function in your body is just as our body cells function. For instance, our body cells work on instructions provided to them by cellular DNA. These instructions are delivered from DNA to RNA to make proteins. In this way, cells perform their function. Similarly, HIV does the same cellular process to cause infection. When HIV invades body cells, it hijacks cellular machinery, particularly the DNA of the cell, by inserting its instructions into it. Then, it transfers instructions to RNA to make new copies of HIV and to make proteins. In this process, because HIV infects T cells of the immune system of our body, with time, it causes a gradual decrease in the number of these white blood cells. Consequently, HIV weakens the immunity of the body. HIV infection has 3 stages. Stage 1 is acute HIV infection, which remains over a few weeks to months and shows flu-like symptoms. It leads to the second stage, known as clinical latent infection, also referred to as chronic or asymptomatic IV infection. This stage lasts for 10 years or longer. At that stage, people might not know that they have HIV, but can spread this virus to others. At this stage, if an HIV patient is not treated, HIV causes a significant decrease in T cells of the immune system at a level at which the disease progresses to acquired immunodeficiency syndrome, or AIDS, which is the third, most complicated, and last stage of HIV. What is meant by AIDS? It is the last stage of HIV at which infected people's immune system is weakened enough that they could die. That's why this disease is life-threatening. AIDS patients are immunocompromised and are at higher risk of getting other infections that do not usually affect healthy people. These infections are known as opportunistic infections. These infections can affect any part of the body and can be caused by a virus, bacteria, or fungi. Additionally, AIDS patients are also prone to cancer, especially skin cancer, known as Kaposi sarcoma. Symptoms associated with the opportunistic infection vary concerning the body's part. If it affects the lungs, then the patient will experience coughing, fever, and shortness of breath, and be at higher risk of getting tuberculosis infection. On the other hand, if this infection is intestinal, the patient will exhibit diarrhea, abdominal pain, vomiting, and swelling problems. Without AIDS treatment, a patient may live just 3 to 4 years. However, it majorly depends on the body's immune system. HIV is still a global public health issue. A report by the World Health Organization revealed that almost 39 million people with HIV have been living globally since 2022, and 25.6 million of them belong to African regions. Transmission or spread of HIV. When this virus was discovered, it was considered as gay-related immunodeficiency virus due to its presence in the gay community. But later on, when knowledge of HIV increased, we became able to understand its transmission modes, including this virus is spread by body fluids, which include blood, vaginal fluid, breast milk, rectal fluid, and semen when these body fluids come into direct contact with damaged tissues, mucous membranes, mouth, rectum, vagina, and penis. Transmission of HIV can happen from a mother to her children, as when she feeds her infants, or it could also spread to the fetus from the mother through shared blood circulation. However, testing and then treatment of an HIV-positive mother could reduce the risk of transmission of this disease. It can also spread by the use of a needle contaminated by an HIV-infected patient's blood or the virus itself. In the USA, HIV is usually spread by sexual contact, especially by those who do not take medicine for it. Other risk factors for HIV include unprotected anal or vaginal sex, and anyone already suffering from a sexually transmitted infection. STIs such as syphilis, gonorrhea, and bacterial vaginosis, having multiple partners, is also the leading risk factor for getting HIV. Receiving unsafe injections and medical procedures that use unsterile cutting can also lead to HIV if they were previously used for HIV patients. Contrarily, HIV is not spread by urine, sweat, or saliva. It is not transmitted by casual contact, kissing, hugging, sharing food, or by any mosquito. Also, HIV is not transmitted to a donor, whether he is donating an organ or blood to a person, because the donor has no direct contact with the receiver in either case. Symptoms of HIV. As mentioned earlier, there are 3 stages of HIV disease, and symptoms also vary concerning them. HIV spreads more easily after the first few months of its infection in a person. The problem here is that many people remain unaware until they reach its last stage. Usually, people within the first weeks do not experience any symptoms of this disease. Others may experience symptoms, which include fever, headache, rash, and sore throat. When the virus weakens the immunity of the person, it leads to other symptoms such as weight loss, fever, swelling over lymph nodes, diarrhea, and cough. If HIV is not treated at this stage, it can develop serious illnesses, which may include tuberculosis, severe bacterial infections, and cryptococcal meningitis. Diagnosis. IV is diagnosed by blood or saliva. If you find yourself being infected by HIV and may have any related symptoms, go for a routine checkup with your doctor. He may take your medical history and, upon suspicion, may advise you a test to detect HIV in your blood or body fluids to confirm the suspect. If your symptoms suspect an HIV infection, but the test reports are negative, the doctor may also recommend another test within the next 3 months if your symptoms persist. Similarly, if your test result is positive, then further testing is required to confirm HIV infection. These tests include the antigen or antibody test and nucleic acid test. The antigen test is to check markers on the surface of HIV called 24. Antibody tests are for a chemical that is formed when the body reacts with P2 markers. The doctor will take a blood sample and send it to a lab where the P24 marker will be detected. This test is usually done after 18 to 45 days of potential HIV exposure. An antibody test is conducted to check the antibodies against HIV in blood or saliva. This test is taken after 23 to 90 days of HIV exposure. A nucleic acid test is used to look for HIV in the blood. It is done after 10 to 33 days of exposure to HIV. If these tests come with a positive result, then the doctor will recommend CBCs, chest X-rays, pap smears, CD4 counts, and tuberculosis. Treatment. There is no ultimate cure for HIV, but some treatment options may lie in a combination of medicines. Antiretroviral therapy, or ART, is aimed at reducing HIV in the blood or viral load. ART medication involves protease inhibitors, fusion inhibitors, CCR5 antagonists, attachment inhibitors, and pharmacokinase enhancers. To control HIV, there are many awareness campaigns and programs, including public health campaigns, education awareness programs, and needle exchange programs. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.